What you can learn from Natalie Merchant and getting your ERISA disability benefits for spinal degeneration with OPLL. You know, I was shocked to learn that she had been diagnosed with spinal degeneration with ossification of the posterior longitudinal ligament, known as OPLL. This is a condition that almost ended her brilliant musical career. But what I want to do today is to explain to you the nature of the disease and how disability carriers will look at these claims. So let's break down the terms here. We all know what a ligament is. It's a soft tissue that connects and supports bones of the joint, and you'll often hear of an athlete tearing a ligament. There are ligaments in different parts of your body. Some are longitudinal, and I'm sure you've heard that term in geography or math class. But this means that the ligament is traveling lengthwise, like up and down your spine. And of course, everybody knows what the word posterior means. Ossification is a process of changing something into a bony like substance. So let's make sense of this diagnosis and an ERISA disability claim. Your posterior longitudinal ligament connects and stabilizes the bone of the spinal column that runs down the entire length of your spine. It runs from your neck all the way down to the sacrum, and it's on both sides. It's attached to the spinal cord. Now, what happens in OPLL is that the posterior longitudinal ligament becomes thicker and less flexible, and it often will occur in the cervical spine, and that can make turning your head side to side or up and down difficult. And it can cause tingling and numbness in your hands. You also might have it in your lower spine, and that means you're going to have difficulty with balance, walking, and even bladder control. As the symptoms progress, as they did in Natalie Merchant's case, it became difficult, if not impossible, to work. And she underwent spinal surgery because of her unendurable pain and had postoperative complications. She was unable to sing for over 10 months. So what does all of that have to do with your disability insurance policy? Well, one of the things that you need to understand is that disability carriers have lots of denial tools in their toolbox, if you will. And as a result, one of the things they'll do is to cherry pick your medical records, and they will be looking for the history of the symptoms of OPLL. Now, OPLL generally isn't noticeable until you begin to have mild pain, tingling, or numbness in the hands, or a funny sensation called dysesthesia. It's an abnormal sense of touch. As the disease progresses, the symptoms become more severe, the ligaments thicken, and they squeeze the spinal cord. This can cause myelopathy and compression of the nerve. And it's the slow nature of OPLL that causes difficulty for the disability carrier. You work today, but you didn't work the next day. So what happened? So as a result, the disability carrier is going to be looking at your medical records for the progression of your symptoms, how those symptoms impacted your functionality, what changed in those symptoms that made you unable to work, what was the nature of the treatment, what was your response, and why can't you work notwithstanding the fact that you had surgery? After all, aren't you Natalie Merchant? So you need to make sure that you're understanding what needs to be proven in an OPLL case so that your claim is successful. We don't want the disability carrier to be cherry-picking your medical records and say, we disagree with the diagnosis, we disagree that these symptoms are disabling, we don't think you got the appropriate treatment, or you should have recovered and gone back to work by now. If you have any questions, call me today at 727-894-3188 for a complimentary consultation.